Pharmaceutical manufacturer Schering-Plough just reported fourth quarter earnings of 39 cents per share. They were beat estimates by just about a dime. The last estimate I saw was 30 cents, although they fell short on revenue. Merck reports earnings in just about 20 minutes. Both are in the process of eliminating 10% or more of their workforce. Now, rival drug maker Eli Lilly is getting good news from the Food and Drug Administration, who's giving its new blood thinner called Pharmaceutical positive reviews, but President Obama has vowed a tougher FDA could mean big changes for the drug industry. With more, I'm joined by Jeffrey Kraws, a senior pharmaceutical analyst for Crystal Research Associates. Good to see you.
Good to be here.
I'm going to butcher all the drug names, but let's first talk for a moment about Schering-Plough and Merck. I know Merck is not due out until 7:30. But you and I were just sitting here talking about all the headwinds facing the industry, whether it's competition from generics, patent expiration, a new administration. How do these guys fare in this kind of climate?
It's very difficult for them to operate in this kind of climate. The one thing that keeps driving them forward is we haven't cured a major disease in the last 70 years, and the people with the money want to live longer. So for these pharmaceutical companies, they're going to have to combine in order to maximize their synergies. They're going to have to cut out the waste and fat that's been in it, and they're going to have to combine their product portfolios as well as look outside themselves. Look more to biotechnology, look more to alternative technologies to come up with cures. It's costing $1.2 to $1.5 billion to come up with a new drug, and it's taking 12 to 15 years. With all those drugs going off patent, there's just not enough time.
It's interesting. A lot of people looked at the Pfizer-Wyeth deal, and they said, you know, okay, this makes sense. This is going to be the beginning of a lot more consolidation, as you talked about. But it was clearly a sign that Pfizer was looking out to a different pipeline, things that are more usable by consumers, that require less investment, less long-term incentive. Very interesting. And is part of that because the Obama administration's talked so much about prevention?
I think it is. They're focused very much on safety. There's been a lot of drugs that have squeaked through that didn't have the best safety profile. And you're seeing pharmaceutical companies revert back to what they had in the 70s and the 80s, which is consumer products. You very eloquently mentioned the Pfizer-Wyeth deal. Pfizer gains Advil to Robitussin, including chapstick. Those are cash-stable products. They produce cash flow for the company. They allow them to enable in research and investment, but there's not a lot of risk there. And it also moves them to a high-margin, very defensible business, which is vaccines.
Let's talk a little bit about the FDA under this new administration. Just initial reaction, what do you think it looks like in an Obama administration versus a Bush administration? Because we don't know a lot just yet.
We've seen approvals. Approvals went up last year. They had 99 new approvals last year. There were 19 new molecular entities, 73 approvals the year before, 21 new molecular entities. So it was a slight increase in the approval side overall, but as far as new drugs to treat new diseases, it was pretty stable. I think the new administration is very much going to look for protecting the consumer safety and requiring after approval marketing so that they can really monitor the patients and make sure that those drugs that are put out there are safe and that they're used for the right patients and they're not used off-label. One of the big things with Waxman and Dingle is people sending out advertisements. You've seen them all on television in your commercials, and doctors prescribing these things for things they weren't intended for. That's going to be cracked down on very heavily by pharmaceutical companies, by the government against pharmaceutical companies.
You know, it's interesting. Another thing that we know from President Obama is how he feels about generics, supporter of generics. And number two, we know one of the first actions he made was for stem cell research. What impact do those two things have on this new world of healthcare?
Very positive impact for generic companies. Right now, 67% of all prescriptions written are generic, and the big positive for Obama is he has a therapeutic substitute in every single category. If you needed a prescription drug for an ulcer medication right now, you can get it in generic. If you needed one for an asthma medication, you can get it in generic. So what's going to happen is, especially in tough economic times, they are going to push through and be much more favorable towards generic drugs as opposed to proprietary pharmaceutical products. So you're going to see generic utilization increase substantially. You're also going to see the barriers for getting biologic generics, which is biotechnology versions of generics, which don't exist. You're going to see Obama pave the way for that so that the tens of billions of dollars can become available in generic form to people who really need those medications. And lastly, stem cells. Stem cells are going to be hugely supportive of because we lost the lead. We're going to get the lead back, and you don't necessarily have to destroy an embryo or a fetus in order to utilize stem cells, and that's something that he knows and that people are going to become more educated on.
Very interesting. I'm sure research and development a big part of this. Jeffrey Kraws, thank you very much for bringing us up to date. Great conversation.